The city of Palm Springs has a universal basic income pilot program. It's administered in part by DAP Health. This program provides monthly cash payments to a select group of residents.
While the program has experienced some setbacks, residents receiving payments say it's an invaluable support system. NBC Palm Springs contributor from DAP Health, Stephen Henke, has more tonight.
Imagine living on less than $1,000 a month with debt mounting, housing at risk, and no safety net in sight. That was the reality for 14 residents of Palm Springs before they were selected for a bold experiment, a universal basic income pilot program that gave them $800 a month, no strings attached. It was a lifeline and a second chance. But the road to impact wasn't without bumps. Tonight, we look at how DAP Health stepped in to rescue the program, protect its participants, and deliver a powerful proof that guaranteed income can change lives. To understand what went wrong and what went remarkably right, I sat down with Tobe, Chief Transformation Officer at DAP Health. He oversaw the program's turnaround after taking full control in July of 2024.
DAP Health, we learned that the administration of the current UBI project was uncertain. And so DAP Health stepped in to make sure that these participants continue to receive their $800 of monthly stipend, but more importantly, the project overall, to show that universal basic income is a proven effective model to help people gain financial sustainability.
But behind the data and decisions are real people, people whose lives shifted because of this monthly support. I spoke with one participant about what $800 a month meant when it was needed.
And when the UBI came along, $800 a month was almost 150% more of what I was making. You know, I'm making about $400, $500 a month and subsisting on that, couch surfing with friends and, you know, things like that, planning where I'm going to be showering next week or things like that. So that UBI money, it meant the world to me.
The final results are in, from housing stability to better mental health. The outcomes suggest more than just financial change. They suggest a pathway to well-being.
If you want to improve someone's psychosocial well-being, get people motivated to go back to school, get a better paying job and reduce stress and fear in someone, look at those results. Providing people financial stability so they can not have the daily stress of carrying that weight around on if they're going to be able to be in the same spot in a week because the first is coming up and they can't afford rent, or how they're going to get food on the table tonight. Those alone is reasons why a UBI program would work and why other cities should look at this.
For DAP Health, the pilot was more than a project. It was a lesson in partnership, accountability, and what it really means to serve the community with integrity.
We learned that partners are not just a mission match alone, that there's a lot of things that we need to do to vet out those partners. Just go through those checks and balances and making sure that regardless of what that risk is, right, that we get proper approvals and make sure that vetting process is solid.
In a time when conversations around poverty, equity, and public spending grow louder, this pilot offers something rare, clear evidence that dignity works, that stability breeds growth, and that when trusted institutions step up like DAP Health did, lives don't just survive, they begin to thrive. The question now is, what could happen if more communities followed suit?
Our thanks to Stephen Henke for that.